If you ask a 2-year-old to give me the ball and then get your shoes, they can follow this two-step command. 2-year-olds can stack 6 blocks. They can also speak with a vocabulary that ranges from 50 to 200 words. And then there are a number of shapes that you can ask children to copy, and they can copy different ones at different ages. Children who are 2 years old can copy a line like what's shown here. And as we'll see in the next few slides, older children can copy these more advanced objects. The developmental milestones for 3-year-olds involve things with the word 3 in the name. For example, 3-year-olds can ride a tricycle. They can speak in 3-word sentences. Their vocabulary is usually 300 words or greater. And then in terms of copying shapes, 3-year-olds can usually copy a circle, but they're not yet able to copy a cross or a triangle. 4-year-olds can hop, they can copy a cross, and they begin to tell detailed stories. If you've ever spent time with a 4-year-old, they will talk your ear off telling you everything that they know. And then lastly, 5-year-olds can skip. Skipping is an advanced motor function that requires lots of balance and strength, so that's something that doesn't happen until around 5 years of age. And 5-year-olds can copy a triangle. Triangles are some of the more complex objects that you can ask kids to copy, and that's what happens when children are 5 years old. Another helpful rule of thumb has to do with how much of a child's language you can understand based on their age. At age 2, you should understand about half the words that a child speaks. By age 3, you should understand 75% of the words, and by age 4, you should be able to understand 100% of the words that a child speaks. When a child is not meeting milestones, that's called developmental delay, as we talked about earlier. And this can involve a single area like social skills or motor function, but sometimes it involves multiple areas, and when that's the case, it's called global developmental delay. This refers to a failure to meet milestones in 2 or more major domains, any of the things we've talked about so far, like gross motor and fine motor function, language, cognition, or social function. And gross developmental delay has a very large differential diagnosis. It includes central nervous system problems, metabolic problems, and others. In many cases, children who have global developmental delay already carry a diagnosis, like Down syndrome or some other genetic disorder, and so the global developmental delay does not come as a surprise. As I mentioned before, hearing loss is a very important, potentially reversible cause of developmental delay. It can present as delay in speech, language, or social skills. So a child with delay in any of these areas, one of the things you have to do is refer that child for a hearing evaluation. So just to give you an idea of how the developmental milestones work, here are a couple of random examples of red flags of children who have developmental delay. So a 6-month-old baby who does not smile, grasp objects, or roll over, and has poor head control, this is a baby with developmental delay because all these things are things that the baby should be able to do by 6 months of age. A 12-month-old child who can't pick up objects, is not crawling, is not standing, and is not babbling, this child also has developmental delay. And then finally, at 2 years of age, if the child's vocabulary is less than 50 words, if they have trouble holding small objects, if they can't climb stairs and they're not feeding or dressing themselves, these are all things 2-year-olds usually can do, and that indicates developmental delay. And it's easy to identify all these things in board questions if you just know those major milestone features we talked about in the last few slides. There's a common cause of developmental delay that often comes up in board exams, and that is Rett syndrome. This is a neurodevelopmental disorder of females, so it only occurs in girls. And contrast this with autism, which is 4 times more common in males. Girls who develop Rett syndrome initially have normal development, but then they begin to regress around 1 to 2 years of age. And that's the hallmark of Rett syndrome. It's regression of cognitive and motor skills. Skills that they used to have, they will lose. This is one of the diagnostic criteria for the disorder. So some of the things you can see in a girl who has Rett syndrome are deceleration of head growth. This is also a contrast with autism. Boys who develop autism often have accelerated head growth. In girls with Rett syndrome, there's deceleration of head growth. And then these girls will begin to lose motor, intellectual, and speech abilities. They also will lose balance and develop ataxia. So this could be a 2-year-old girl who was walking and now begins to stumble and is unable to walk any longer. This could also be a girl who was progressing in terms of her speech and now does not have the same speech ability she had a few months ago. Another classic feature of Rett syndrome is repetitive hand movements. So girls with this condition will do things like hand-to-mouth licking, they'll grab their clothing or hair, they'll wring their hands, and they'll do these things over and over again in a repetitive manner. Rett syndrome is an X-linked disorder. It's X-linked dominant, so one abnormal gene leads to disease. And 99% of cases are caused by a sporadic gene mutation. The reason it occurs in girls is because girls have two X chromosomes, and due to random X inactivation, they have some cells in their body with a normal gene, and this allows them to survive. Males have only one X chromosome, so if they have an abnormal gene, they will have all abnormal genes in all the cells of their body, and this is lethal, and so males will not survive to develop Rett syndrome. On this slide, I've shown some select causes of developmental delay. These are ones that often come up in your board exams. So I talk about autism in the video on child psychiatry, but it's a classic cause of developmental delay. It usually occurs in boys, and boys who have autism have normal motor development. There are no motor impairments, but they can have impaired language development. And what's unique about autism and what can help you to recognize it in a board question is that boys with autism develop stereotyped patterns of behavior. And these are things like rocking or flapping their hands or repeatedly talking about certain topics. And I go through this in detail in the child psychiatry video. Selective mutism occurs when a child does not want to talk in certain situations. This can give the appearance in the pediatrician's office of impaired language development. This mostly happens in girls. They have normal motor development, and the hallmark is that they won't speak in specific situations, but the parents or caregivers will tell you that they speak normally at home, for example, even though they won't in the doctor's office. And then we talked about hearing loss earlier in this video, but children with hearing loss have normal motor development but impaired language development, and the hallmark here is that they do not react to sounds and noises. I'll finish with this slide on primitive reflexes. Primitive reflexes are reflexes that are present at birth, but they resolve as the child gets older. The reason they go away is because corticospinal neurons become myelinated as the child ages, and that leads to the loss of these reflexes. These reflexes can come back in adults if they have neurologic damage, because what happens is the myelinated neurons suppress these reflexes. But if you have damage to neurons from a stroke or some other process, then these reflexes can come back. So on your pediatrics rotations, hopefully you will get to round in the newborn nursery. And one of the cool things to do in a newborn nursery is elicit all of these reflexes because they will all be present in newborn babies. The first one is the hand grip reflex. If you place an object in a baby's palm, the baby will wrap its fingers around the object and grasp it. You can do this by putting your finger in the baby's palm. This is called the hand grip reflex, and it usually disappears by 3 months of age. The sucking reflex is that the baby sucks when the roof of the mouth is touched. So if you put your finger in the baby's mouth and touch the roof, it will begin to suck on your finger, and this reflex goes away by 4 months. The Moreau reflex is also called the startle reflex. If you startle the baby will extend his or her arms outward and then bring them back in, and this reflex is gone by 4 months. The rooting reflex refers to babies that turn their head towards the side of a cheek when you stimulate the cheek. So if you rub the baby's cheek, it will turn its head in that direction. This reflex lasts till about 6 months. The glant reflex refers to when you stroke the spine on one side, the baby swings the torso towards that side. So you can do this by holding the baby in the air with its legs dangling, and then if you stroke one side of the spine, the baby will swing its entire torso to that side. It's actually a pretty cool reflex to elicit in the newborn nursery. It goes away by about 9 months of age. And then lastly, the plantar reflex is dorsiflexion of the foot and flexion of the toes with plantar stimulation. This goes away at about a year. And you may know that in neurology we often test for the plantar reflex because if it comes back in an adult, it indicates that there has been severe central nervous system damage. And that concludes our module on developmental milestones.